Start getting Botox when you feel ready. A lot of patients like to start before their lines start getting etched in, usually in their mid to late 20s into their early 30s. Quite often I find patients that start later in life, the lines are really etched in. They're not so happy because we can't fully take them away.
Hey ladies, drop it down. Just wanna see you touch the ground. Don't be shy, girl, go bonanza. Shake your body like a belly dancer.
I ain't never been with a baddie. She calm, so I add her to the tally. Oh shit, okay, here we go.
Nah, I ain't never been with a baddie. She calm, so I add it to the tally. Madison Button calling her Maddie. Like,
Have you heard of the skin pen microneedling treatment? This is safe for all skin types and tones and useful for treating fine lines, pore size, texture, hyperpigmentation, and stimulating collagen. We're using tiny needles to make micro injuries into the skin so the skin comes back to repair itself. There's very minimal downtime with this. I recommend 3 to 6 treatments spread out about 1 month apart. Patients love this. When you're ready, come see me. Yes, I have a lot of patients that come in and treat multiple areas of their face in one appointment. It's very common for patients to treat under eyes and cheeks at the same time, their chin and jawline, and a lot of people like to top things off with lips. The biggest thing is that we discuss your treatment goals and figure out a plan that will best serve you. This patient came in after noticing some changes to her under eye. She felt that she looked tired even though she wasn't tired. When we checked things out, we noticed that it wasn't just her under eye that was having volume loss, but also her cheeks. So we did some filler and really addressed her mid-face by treating both her under eyes and cheeks. When we finished, her face had a lifted appearance, her under eyes looked brighter, and she told me this is what she looked like 5 to 10 years ago. She was really happy with how things turned out. If you have questions, let me know.
I got a skin pen microneedling treatment today. Helps treat fine lines, pore size, texture, dark spots, and stimulates collagen. Safe for all skin types and tones.
I've told you before, under eye filler was one of my favorite things I've ever done to my face. After it, I just look rested and refreshed, even though I was so tired. It lasts a long time. I think you'll love it too. If you have questions, let me know. With under eye filler, you can definitely bruise and swell, so be mindful when you're planning your appointment. Give yourself at least 2 weeks before any major events. Try to avoid blood thinners and alcohol to minimize your bruising risk, and take some arnica before you come in. When you're ready, come see me. My friend only got 20 units. Why do I need more? Because you have different faces. Your Botox dose depends on the areas you're treating, how big and strong your muscles are, and what you want your outcomes to be. Different faces, different doses. If you have questions, let me know. Top reason people encounter filler migration, they're trying to put way too much product in the same spot way too quick. Don't rush the process, and you've got to know there are limitations on what can be achieved with Botox and filler. If you have questions, let me know.
It's happening. I'm a big baby though. Totally normal. I can eat, I can smile, I feel like a human being with a jawline.
What can we do with filler in the nose? Straighten, lift, smooth, and contour, all without going under the knife. Check out some of my Instagram nose highlights to see some before and after pics. If you have questions, let me know. To some, this patient may not have as severe of a tear trough deficit. However, she was unhappy with the early signs of hollowing that she was noticing. So we did some filler. You can see here, we softened out her under eye hollowing, softened out that shadow, just gave her a fresh look. She's really happy with it. If you're like this patient and those early signs of aging are making you feel that you're not your absolute best self, let me know. We'll see what treatment's right for you. This is Botox into the masseter or jaw muscles for treating TMJ symptoms. I have a lot of patients that clench or grind their teeth, which causes jaw pain and migraines. You can see me here injecting into the muscle. This is going to relax the muscle and relieve the tension, jaw pain, headaches. This can also slim the lower face, so sometimes we use it cosmetically for facial shaping. Typically, we use about 20 to 30 units per side to start, and it lasts about 3 to 4 months. Girl, these lines on my face, it is time for some Botox. Girl, don't mess up your face with that. Everyone who gets Botox looks crazy. Psh, she doesn't even know. Actually, I've been getting Botox for years. Wait, what? Yeah, I still look like myself. I can move my face. The lines are just softened up and I look refreshed. Okay, who do I need to see to get mine? You gotta see my girl, Ginille. This patient had Botox into her chin for the dimpling. When our mentalis, our chin muscle, is contracted when we're talking or pursing our lips, it can create that dimpling effect. Some people don't like that and they'll put Botox there to smooth things out. Here she is 2 weeks after her Botox is fully kicked in. She doesn't have the dimpling anymore. She still has her normal function. Things just look a lot smoother. If you have questions, let me know.